allows to do. And you mentioned about taking it with something. This is what we found with all immune modulators, that they're much better in combination with other agents than by themselves. And one of the things that we have been researching independently, and it fits beautifully, is that is the great, what I would call, endemic epidemic of low vitamin D in the population, and particularly in the winter months and the further north you go. And this is one thing that we have been looking at very carefully, because we think that there is a positive interaction here. But that's not a big surprise, because if you're low in vitamin D, you don't respond to a whole range of things, and chemotherapy, whatever. So that's one particular thing. Combining it with other immune modulators, stroke vaccines, is the next obvious way to go, as is enhancing the anti-inflammatory aspects of it. So all these things we'll be looking at in our research, both in the lab and taking it forward into the clinic. Given how non-toxic it is and how relatively cheap it is compared to other interventions, could be applied to, I would say, the vast majority of people who have uncurable cancers, whereas you can't cut them all out, because the anti-inflammatory aspect for most cancers is now well established, and the need to boost the immune system when you have a cancer. In fact, one of the pieces of research that we did early on, I'm most proud to have done, and that we showed that even patients with very early colorectal cancer have a major suppression of the immune responses, and we proved that this was due to the bowel cancer, the patient group we used, because we repeated the assays a month after the tumour had been completely removed, and the immune system all bounces back into the normal range. So after that, and colleagues elsewhere showed that they got the same sort of thing with other solid tumours, lymphomas, gliomas, etc. So it means that tumours immune suppress, and if you can't cut them out, you want to go some way to correct it. There's some very many fancy, toxic, expensive ways of doing that, but low-dose naltrexone does a lot of those properties, provides a lot of those properties without any of the toxicities, etc. So as a universal supplement as well, to be an anti-inflammatory immune booster, I can't see why it would be limited to any particular tumour type.